Thank you very much. My work is so different from tripanel only the closest I've come to tripanel is in Uganda, in Utro. My research is on mental health problems. War and mental health problems, and the Great Lakes region, especially, has witnessed decades of, and as a result, more than 60% of the youth in the Democratic Republic of Congo, Uganda, Southern Sudan, Rwanda, Burundi, have been exposed to some children in particular. And the abduction especially was used by the rebels in a very, very cunning and very cruel strategy that was known as burning the bridge. Burning the bridge strategy meant that you have to cut the sever the bond between the children that you abduct and their families and their communities, meaning that you have to use the children to raid their own villages, to kill their own people, so that you have their loyalty and you have them in bondage. And yet, there were also inadequate mental health services. And as a result of massive displacement in the north of the country, this also led to a phenomenon that we now refer to as post-conflict conflict. That is, the way the conflict was managed now results into more conflict afterwards. For example, because many people stayed in captivity and in the camps for a long period of time, they have learned to be helpless, so there's learned helplessness. And because especially women were empowered by NGOs and all the international organizations, men now became helpless, they were disempowered. And during the post-conflict, this also led to a lot of domestic violence as a result. And of course, as it is with all other wars, the destruction of the local economy and also with local services such as education and health. This is a girl who was abducted when she was about 14 years. She was taken into rebel captivity. When she came back with 3 children who were fathered by rebel soldiers. Maternal displacement, this was an aerial view of a crowded and unsanitary internally displaced people's camp, and there were about 150 of these in the north of the country during the height of the war. And in captivity, many of the children were also tortured. You can see this boy here was whipped a lot because he burnt the food for the commander. And so the commander had to give him, to punish him by whipping him all over This girl was accused of being a witch, and she was dragged on a rocky surface, and she had all these scars, very ugly scars as a result. So there was also a lot of torture in rebel captivity. So as a result, we came up with a study to look at the long-term mental health consequences of the war on the population. And we named the study the War Affected Youth Study, or WAVES. And the goal of the study was to contribute to some evidence base in order to be able to develop interventions which can then be based on some evidence, on some research evidence to respond to the mental health needs of this war-affected population. And the rationale for this was that many previous studies were basically cross-sectional, and yet the effect of war on the population is often long-term. And the war-affected population were also treated as if they were a homogeneous group, but these were really, really different groups. For example, the girls who were abducted and stayed in rebel captivity for long were in themselves not the same. You find that there were girls who were abducted and they were sexually abused. There were girls who were abducted and they were not sexually abused. There were also others who were abducted, sexually abused, and had children as a result. Now, all these three groups, as I will demonstrate later on, have got different needs. So it is not right for us to, as it is portrayed in previous studies also, to consider them as if they were really the same group. There were children who were born, for example, in captivity, and there were others who were not. They were born in the communities. All of them had some different levels of exposure. So in many previous studies, all these groups are just considered war affected, and they're considered like they're the same group. And also contextual risk factors, for example, at the level of an individual, at the level of the family, at the level of the community, were not taken into consideration. More especially the post-war context. Because, there's very little that we can do about what has happened. The war experiences that these people have experienced while they were in captivity. So the post-war environment also becomes very important, especially when we are looking at the reintegration of war-affected youth. So the post-war environmental factors are important, and they are the ones that can keep the youth in the path of mental health problems, or remove them from the path of long-term mental health consequences which are adverse. And also, many of the post-war, previous studies also concentrated so much on the mental health problems, the deficits, the PTSD, the depression, and so on and so forth. And also did not really consider the resilience aspect, and not only the resilience aspect, but also the adaptive capacities of these young people. For example, looking at the pro-social behaviors, the positive things that the youth are capable of doing. And more importantly, as a result of this, also there was not much attention was given to the development of human capital to respond to the mental health needs of this population. Many researchers who fly from London or from New York or from Washington go and sample a few war-affected youth, look at their PTSD levels and so on and so forth, and fly back to Washington or New York or London. And at the end of it all, you are a cadre of researchers at the local level. It's not tough. So as part of Thrive, therefore, it was considered that local researchers should be able to be trained so that they can be able to train others to respond to the mental health needs of the population. So this was a very important aspect of it all. What did we do then as a result of these, as a result of the way study? The way study, therefore, considered that we should look at this from the social ecology point of view or model, and looking at the youth who are affected by war from an individual perspective, from the family perspective, the community, and the society. And because also previous studies just looked at individual responses to their PTSD, and we did not really look at this from the point of view of the family. How can the family, through its resources, through its acceptance, through its functioning, contribute to either exacerbating mental health problems or reducing mental health problems? And what about the contribution of the community through services, maybe stigma, maybe support, and so on, contribute to the well-being of this group? How about for example, the government through its policies, through political will? What about the role of the culture at societal level in contributing to the reduction or increase in mental health problems? So our research was basically aimed at contributing in a small way towards looking at this in a very holistic manner. All right. So what then did we do? We set out to look at all these contextual problems. Contextual factors that predispose, which were risk or protective factors for long-term mental health problems. And we also went on to investigate the deficits and the adversity, the adverse mental health outcomes as a result of the war experiences. And so what we did was to recruit about 540 formerly abducted youth. This was just the beginning. And so as a result, we followed this and collected data at 2 time points from them. And I'll just briefly tell you about some of the findings that we came up with as a result of the study that we started. Many of the youth, about 70% of them, were abducted before the age of 15. General exposure to violence was similar in both genders, but of course, with sexual violence, involvement in hostilities and physical injuries, there were gender differences. And 65% of the girls reported experiencing sexual violence compared to 10%. And 10% of the boys. And for mental health outcomes, we could already see that this was associated with particular types of war events, which were exacerbated by certain environmental factors and also protected by certain factors in the community. Now, this was an idea of trying to look at different contexts of the social ecology model to try to find out which aspect would contribute to either a reduction or a decrease in mental health problems. So the youth who are able to better adapt were those who are given opportunities for education and social skills, those who are accepted, those who experience reduced community relations or stigma, and those whose families were functioning well, and all those who witnessed violence, killed during combat, and were sexually abused, and had death and bereavement, were really not adapting properly in the community. Now, I just want to tell you something about this study. Now, in this result, what we looked at was to look at 3 categories of exposure to sexual violence. The first was girls who were abducted, taken into captivity, and reported that they were not sexually abused. Secondly, the girls who were abducted, taken to captivity, and reported sexual abuse but did not have children. And thirdly, girls who were abducted, taken into captivity, sexually abused, and having children as a result. And you can see very, very clearly here, for all the psychosocial outcomes, you could see already that those who are abducted, sexually abused, and had children as a result are suffering more in terms of all these mental health outcomes. And so the post-war environmental stressors are important, and they are the driver of long-term mental health problems, especially in this group of youth that we study. And in conclusion, we think that we have some evidence now to begin some kind of work, especially at the level of intervention. For example, we can now start some self-help cognitive behavioral program to reduce mental health problems in this group. And in future, we think that we should now focus more on these products that can be able to help this youth to live more meaningfully and reduce mental health problems and so on and so forth. And I want to thank the University of Cambridge so much because of the leadership and also the mentorship that I got from Professor Peter Jones here and Professor Tim Crowdes, who is now at the University of York, Professor New Buga. And as a result of all this support that I got from these people, we have been able now to have several publications as a result of this work. So far, we have about 7 publications now in the past 2 years as a result of the work that I've been to Cambridge. I think this is my 5th time in the past 2 years. And I've benefited enormously. And I think that Cambridge has a unique opportunity to contribute to quality education in the world, not only because of history, 800 years of excellence, but also because of the brand that is Cambridge. And when we talk about Cambridge, wherever you go, it opens doors. My father did a Cambridge school certificate. Whenever I'm coming to UK, he asked me, "Where are you going?" He said, "I'm going to Britain." "Oh, where is that?" I said, "No, I'm going to England." And he said, then he see him away. And then he said that, "Well, if you're going to Cambridge, then I think you're going to Cambridge." Because I did a Cambridge school certificate. And he's still very proud about it. So you have the history, you have the brand, and that brand can open doors, especially with regard to quality research that can contribute to solving problems related to poverty in the world. Thank you so very much.